Hello and welcome everybody to our Medicare 102 presentation tonight from Phoenixville Public Library. We are fortunate to have with us again PA MEDI counselor Gary Davis to take us through the paces of Medicare for those of you who are already Medicare recipients. So those of you on Zoom, please stay muted and type any questions you have during the presentation into the chat and I will relay them to Gary. So Gary, take it away and welcome again.
Okay, thank you, Mark. Thank you for being with us tonight. This presentation is Medicare 102. It's for people who have been on Medicare for a while. So we're not going through the basics of how to sign up for Medicare and the real basics. So we're going through a little more advanced stuff, a little stuff that may be less commonly thought of, and hopefully expand your knowledge about what is probably your primary health insurance for the rest of your life. As Mark said, I'm a counselor with the PA MEDI program. That's part of Chester County's Department of Aging. And one of the things a Medicare beneficiary you should know is you should know about this program and the services it offers you. So I want to touch on that for a minute. PA MEDI is the name of Pennsylvania State Health Insurance Assistance Program. All 50 states have a similar program by federal mandate. In Pennsylvania, it's now called PA MEDI. Offers free, independent health insurance counseling, primarily around Medicare. All the counselors, like myself, were trained and certified volunteers. And that's important because since we're volunteers, we're not commissioned salespeople. We don't get paid by steering you towards one product or another. Our goal is to educate you about Medicare so you understand the program, you understand your options, and the pluses and minuses of the different options. Important thing is how can we help you and how can you get in touch with us? Oftentimes you may want to sit down and have a face-to-face discussion with a counselor. An issue you're having, a problem you want to talk through. And you can do that anytime throughout the year. We have counselors available here at Phoenixville Library, as well as all the senior centers throughout Chester County. And you can call your nearest senior center, wherever that is, or the library here, and schedule a one-on-one appointment. They are by appointment only because the counselors are not at all the sites all the days, so you do have to book that in advance. Hello. Hi. The other thing was we have a PA MEDI helpline where you can call any day and leave a message. You see the number there, 610-344-5004, option 2. You leave a short message, and we have a counselor monitoring those calls Monday through Friday, and they'll get back to you normally within a couple hours, but certainly within 24 hours. Here's some of the topics we're going to talk about tonight. Medicare terminology and a roadmap, the costs for Medicare in 2026, some of the Medicare benefits. We're going to talk about drug plans for 2026, getting help with Medicare costs, how and when to change plans, and some information about your Medicare rights. That's a copy of the slides.
Thank you.
Terminology. There's often confusion between Medicare and Medicaid, so just touch on that briefly. Medicare is a federal program, and it is the primary health insurance for most retired seniors. You become eligible at 65 or earlier with certain diseases. Doesn't mean you necessarily have to have Medicare at 65. If you're still working and have group coverage, you may be able to delay that, but for most people after 65, it does become your primary. Medicaid is a state program, partially funded by the federal government, but it is a state program to help people who have limited income and limited financial resources with their medical programs and their medical bills. Tonight's presentation is about the federal program Medicare, not about Medicaid. This is a roadmap. It's a very important slide. One of the things it shows, and anyone on Medicare should definitely know this, is you do have a choice of how you want to get your Medicare benefits. You can get them on the left side of this, which we call the original Medicare path, or you can get your benefits on the right side of this roadmap, which we call the Medicare Advantage plans. So you're already on Medicare. That means you selected one of these paths at some point when you first signed up. That doesn't mean you need to stay with the same path for the rest of your life. Okay? You can change. And later in the presentation, we'll talk about when and how to change. That's during the open enrollment period, which is coming up here very shortly. It starts in mid-October. But briefly, these two options that you have, the left-hand side, original Medicare, some of the key things that differentiates that. There are no networks. you can go to any doctor, any hospital in the country, as long as they take Medicare. So if you want to go to the Mayo Clinic to see a specialist about something, your coverage is as good there as it is here in Chester County. Okay? If you travel a lot during the winter, maybe you're away for a month or two in the winter to someplace warmer, your coverage is as good there as it is here. So a lot of flexibility with finding providers when you choose original Medicare. Many people who have original Medicare choose to get some form of secondary insurance. It's not required, but most people do choose some form of it to help pay for the deductibles and co-pays that Medicare Part A and B does not pay. Medicare does not pay 100%. It was never designed to pay 100%. There are co-pays, there are deductibles, and those can add up. So many people will choose a Medigap policy, which you can buy from a private insurance company, and they will cover most of your Part A and Part B deductibles and co-pays. So instead of risking how much those deductibles and co-pays might be in a given year, many people would rather pay an insurance company a set premium and know that they're going to cover most of those expenses. The last piece of your coverage, if you choose original Medicare, would be a Part D drug plan. There's 12 different plans available for Pennsylvania Medicare beneficiaries, and we can help you decide which one's most cost effective for you. It's a very good tool in Medicare.gov that we can help you with. Plug in your medications, and it costs out all 12 plans and ranks them based on least expensive to most expensive. Very important to look at every year during open enrollment. Medicare Advantage option, those are network-driven plans. Original Medicare, no networks. Anyone who takes Medicare, you can go to. These are all network-driven plans. So all the Advantage plans that are available have a list of doctors and hospitals who have agreed to be part of that network. So if you're considering the Advantage plans, one of the key due diligence is to look to see if your doctors are in their plan, part of their network. You know, most people in Medicare don't want to have to change doctors to accommodate the insurance company. You want to be able to continue to go to the doctors you're used to. So being that these are managed care, the insurance company is a little more involved in the overall management of your care. So with these Advantage plans, as you get into needing more expensive treatments, more expensive testing, you will run into more pre-authorization requirements. That your doctor may say, I want you to do this, but we got to get the insurance company's okay first. Okay? Pre-authorization. And with that, you're going to run into more denials on this side of the map. Fact of life. Not being critical of this side, it's a reality. But that shouldn't deter you. Anytime you get a denial, I'll talk more about denials later, there's appeal processes that you can go through to have that reconsidered. One other comment here on the Advantage plans is they do offer some extra benefits that you do not get on the original Medicare side. Most of them include some dental coverage, some eye, hearing aid, glasses coverage, and some additional benefits I'll touch on later. But they are allowed to offer some extra things that original Medicare does not get. So you should always know you have these options, and at least once a year during open enrollment, you could consider switching if you wanted to. Let's look at the cost of Medicare for the different parts. Part A is the hospital part of Medicare, covers you if you're admitted to the hospital. Most people do not pay a premium for that. If you or your spouse have worked for 40 quarters, 10 years during your life and paid normal payroll taxes, you have paid up for Part A and don't have to pay a premium. So very few people pay a premium. There is a deductible for original Medicare. The deductible is $1,736 this year, meaning if you're admitted to the hospital for anywhere from 1 to 60 days, it covers up to 60 days, you're responsible for a $1,736 deductible under original Medicare. Advantage plans have a different payment schedule for hospitals, and each one's different, so I can't cover all those. But if you have a Medicare supplement plan, that secondary insurance I talked about a slide ago, that would cover that $1,736. You would not be paying that. Part B is the outpatient insurance, so that's going to see doctors, lab tests, specialists, physical therapists, all the stuff you do when you're not in hospital. There is a monthly premium that everyone pays there. This year it's $202.90 per month. Yours could be higher. They look at your income from 2 years ago, and if it's above certain thresholds, about 109,000 for single and 218 or so for joint filers, you could be assessed a higher premium. You'd be notified by Social Security and explained why, but it could be higher. Part C is the Medicare Advantage plans. So the roadmap that I showed a minute ago, Advantage plans were on the right. So that whole right side Advantage plans are called Part C of Medicare, and that's an option. In order to sign up for a Part C plan, you already have to be enrolled in A and B. Okay? So, which means you would be paying the Part B premium, even if you choose an Advantage plan. You can't get away from that. Many Advantage plans don't charge a premium over and above that Part B premium. Many of the ones, if you sign up for it, it's zero premium. Those are the ones people tend to gravitate towards. There are ones that charge a premium, okay, including ones that are over $100 a month. But the majority of the ones people choose today are zero premium plans. They do have deductibles, co-pays, and co-insurance, and it varies by plan. There's over 70 different Advantage plans available in this area, and each one has a different schedule of how much you pay. But typically you have an out-of-pocket cost for each service you use. Might be as low as $5 or $10 to see your primary care, might be $50 to see a specialist, might be $250 to get an MRI, might be $350 a day at the hospital for the first 5, 6, 7 days. So there's an out-of-pocket cost associated with each service. If you need chemotherapy, it might be 20% of the cost of chemotherapy. That's where the numbers can really get high when you get into those type coverages. Part D is a drug plan. You need a drug plan. The premiums vary. Of the 12 that are available this year, the premiums vary as low as $660 per month up to almost $200 per month. It's all a function of what medications you're taking and which plan is going to be least expensive for those medications. If you're just taking generics, a plan that costs $660 a month or $820 a month is going to be fine for you. If you have an Advantage plan, most of them have a Part D drug plan built into them. You don't select it yourself. If you're selecting this particular Advantage plan, it has a drug plan built into it. I want to talk briefly on mental health benefits. A lot of people don't think that these are covered under Medicare, and they are. This is a list of some of the mental health related benefits that are available through Medicare. Outpatient care, partial hospitalization, inpatient care, various screenings and treatments are available. So, you know, keep this in mind, and you know, as you talk with your doctor, if any of these would be applicable, remember Medicare will cover them as medically necessary. Medigap plans, just a couple things on this. So these are, if you think of the roadmap that we had a couple slides ago, on original Medicare on the left side, that middle block was the secondary insurances. That was those Medigap. These are the plans you can buy from an insurance company to cover your deductibles for A and B. These plans they're age-based, which means we age every year. Your premiums are going to go up every year. Also, medical cost goes up every year. So if you have one of these, certainly expect an increase every year. Maybe one year you get lucky and there's not one, but you certainly need to expect that. You can switch these plans at any time. So they're not constrained by the open enrollment period that I'm going to talk about later. These you can change anytime. Maybe you get a notice from your Medigap insurance company in March that says your premium's going up 15%, okay, because we had lots of expenses. You can apply with another insurance company right then to try to switch to another Medigap provider that might have lower premiums. Okay? One caveat there is the application for another insurance company's plan is going to include health questions. Okay? Which, if you got your original Medigap at the time, Medigap, when you first signed up for Medicare, you wouldn't have had to answer them. Now you will. So the applications will ask you about your health, what you've been diagnosed with, when's the last time you were hospitalized, what are the meds you take, etc. And based on your answers, they can deny you coverage. So we don't want you. In which case, even though your plan went up 15%, you probably should stick with it because you may not be able to get another one, at least at this point in time. Okay? They can also charge you more, say, yes, we'll accept you, but instead of the standard rate, you're going to get a 30% higher rate because of your medical conditions. Okay? So the key thing is, even if you're applying for another plan, which it never hurts to do, I mean, there's no charge to do that, don't stop paying your existing one. Because while your intent is to switch, based on the medical underwriting, you may not be able to accomplish what you want to. So don't end up losing what you have. Prescription plans for 2026, there were some changes. A lot of these changes were phased-in changes that really became law back in 2022 as part of the Inflation Reduction Act. There's no longer a donut hole. For those of you who may have been on Medicare for a number of years, there used to be a donut hole when prescription costs actually went higher partway through the year. That's gone. And there's now an out-of-pocket cap for this year's $2,100, meaning if your deductibles and co-pays for your prescriptions hit $2,100 in the calendar year, you have no co-pays for the balance of the calendar year. Now, I know some people are on some very expensive prescriptions, and they've already hit that cap. So their meds for the rest of the year are zero copays. Last thing on here is a payment plan. This was, again, new a couple years ago. Many of the plans, if you're taking brand name drugs, you're probably going to have a deductible to meet. Typically don't on generics, but with brand names you often do. So if you're taking a brand name drug and your plan has a deductible of $615, which many of them do, that means in January and February, when you first fill that a couple times, you're going to be basically paying less price until you've hit that deductible. So some people end up with paying a lot of their costs in the first month or two. And to offer an option for that, they came up with a payment plan that any Medicare beneficiary can sign up with through their drug plan, which essentially stretches out the payments roughly evenly over 12 months. So it was a good idea. This plan has not gotten a lot of people enrolled in it. I don't know if it's lack of interest or just not needed, but it is out there if you wanted to consider it. For 2026, I used the number a minute ago, the maximum deductible is $615. Medicare sets that. Okay, we have 12 different drug plans in Pennsylvania. Each insurance company decides what they want their particular deductible to be. As long as it doesn't exceed $615, Medicare is fine with it. It certainly can be lower. The 2100 cap, I already talked about that on the last slide. And that goes up about $100 a year. It was $2,000 the prior year. It'll probably be roughly $2,200 next year. But you know, there's some very expensive drugs out there, so this really has saved a lot of people a lot of money. Transition refills. What are these? Sometimes this is particularly helpful during the first couple months of the calendar year. Okay, many people change their drug plans during open enrollment, so they might have a new plan as of January, or their plan they have been in may have had significant changes to it. Plans tend to change every year. So during that first 90 days, if you're in a new plan, you may obtain a transition refill if a drug you've been using is no longer covered by your drug plan. Okay, they covered it last year, but they must have dropped it, and you didn't notice that to change plans to enroll in one that had it. Or maybe the drug is still covered by your plan, but it now requires a pre-authorization before they will allow it to be refilled. If you run into a situation like that, you can get what's called a transition refill, which is essentially a 90-day prescription for that med. Okay? So that gives you time to either get the pre-authorization approved, working with your doctor and the insurance company to get it approved, or to perhaps talk to your doctor about a different medication. Vaccines. Medicare does cover at zero cost all the vaccines you see here. Okay? which is similar to what they do with a lot of preventative services as well. They want to encourage people to get preventative work done. They want to encourage people to get vaccinated. I mean, the whole idea is if these things can identify problems earlier or keep you healthier with vaccines, it should save money in the long run and help everyone's situation. So that's the goal of these. Some of these, you notice, are paid for actually under Part B of Medicare and others Part D. I mean, as long as you have both B and D, which you should if you're fully on Medicare, it really doesn't matter to you which part they're paid for. That's a behind-the-scenes thing. The main thing is they're available with zero copays. COVID-19. Used to talk a lot more about COVID-19 stuff. That's really died down. But it's still out there. Medicare has changed some of the things related to COVID-19. They no longer cover the over-the-counter tests they did during the big COVID period. They no longer will do that. They will pay for lab tests, for diagnostic tests that were ordered by a healthcare provider as part of his diagnosis, and you need this test, just like a blood test. They will pay for that. It varies by Advantage plans. Some have zero copays for that type, others might have a copay. Each plan's different, so I can't give a blanket answer on that with Advantage plans. And there is an updated COVID-19 vaccine by the various companies. Actually, I got mine about a month ago, updated COVID. Medicare Advantage plans. I talked about this briefly earlier, just want to touch on a little more detail here. One of the advantages of Advantage plans is they are allowed by Medicare to offer some benefits that original Medicare does not cover. Okay? They have a list of benefits they can offer. They can choose which ones and how much. But Advantage plans are very competitive. All big insurance companies offer them, and they all want to compete for your business if you're an Advantage user. So they all tend to offer the same extra benefits roughly in order to be competitive. Most of them offer dental coverage, vision, and hearing. Certainly at least kind of what I call the basics, the 6-month checkup, cleaning exams, maybe an annual vision exam and hearing exam, maybe an allowance towards glasses and reduced price hearing aids. And on the dental, maybe an allowance towards some more expensive stuff, maybe $1,000 a year allowance towards, crowns or fillings or those type of things. Again, it varies. Now, remember, these are all network driven, so you would need to go to dentists who are in their network. You would need to go to the vision and hearing folks who they have contracted with. All the Advantage plans have to have, by Medicare dictate, is a maximum out-of-pocket. The maximum any of those can have is $9,250. Most of the plans that people select today have a maximum out-of-pocket between $7,500 and $8,500. What does that mean? As I mentioned, with the Advantage plans, you have copays when you use the services. $50 for a specialist, $250 for the MRI, whatever. If your out-of-pocket cost for those medical copays, not prescriptions, hit the maximum during a calendar year, then you would have no more medical copays for the balance of the calendar year. So if you hit the maximum in September, any medical copays for the rest of the year are going to be zero. And then the clock starts over come January 1st. So again, most of the ones we see are between $7,500 and $8,500, which is pretty high. If you hit the maximum, very few people do. You got to have a really bad year to hit that, but a couple percent do every year. So that is a significant amount that could be out of pocket in 1 year. But at least there is a cap. It's not an unlimited situation. And there's also some other supplemental benefits that some of the plans will offer. Some will deliver meals to your home after a hospital stay. Right? Some will provide free transportation to medical appointments up to a certain number per year. Some will actually give you money back. They're called give back programs. And what they say is they're giving you back part of your Part B premium. And that's what they actually do. So if your Part B premium is $202 and they have a $50 give back, then the amount that's gonna come out of your Social Security is not gonna be $202 a month, it's gonna be $50 less than that. Okay. Now, while that sounds great, okay, the flip side is if they're giving you back money, then they have less money to provide benefits. So if you look at two plans from the same insurance company, Plan A gives you 50 back, Plan B does not give you anything back. Okay, Plan B has better benefits. It has lower copays. It has, you know, more to it. So you don't get a free lunch. If you're getting the $50, you're going to get less on the other side. And the other thing that most of them offer is an allowance towards over-the-counter. So they might give you a quarterly allowance, $30, $40, to buy over-the-counter medical-related things. You can buy, you know, your Tylenol and toothpaste and Band-Aids and vitamins and that type. Okay, we're back to the roadmap. The original Medicare on the left side, the Advantage plans on the right side. This is a good point. Just take a stop, ask for questions on anything we covered so far, or any other question that pops up. Any questions here in the audience?
How many Medigap plans did you say are available in Pennsylvania?
Medigap.
Yeah.
Medigap.
Or I'm sorry, the Advantage.
The Advantage plans. There's over 70.
That's what I thought.
Okay. Now there's probably maybe a dozen insurance companies, and each insurance company offers 4, 5, 6, 7 different plans. Okay, because they're just trying to meet different audiences. Someone wants a really low premium, so this is our 0 premium plan. Other people may be more focused on having more robust dental benefits, so this plan's going to have more robust dental. So it's just attempts to just meet different people's needs. But that's one of the reasons why most insurance companies don't just have one. So, anything on the?
No, nothing on Zoom.
Okay. Anything else?
I got one.
Yeah.
Do you have one? Would there be an advantage to have like a Medigap policy over an Advantage plan if you have like pre-existing medical conditions?
That's a good question. The with original Medicare, if you have a Medigap with original Medicare, okay, then you pretty much know what your medical costs are going to be for the year, because you know your premium is you're paying for this Medigap. And so if you have a really bad year, however you imagine a really bad health year, your out-of-pocket cost is not going to be much higher than a really healthy year. Because on those really bad years, the insurance company you bought the Medigap from is picking up all those extra copays, all those extra deductibles. And once you get one of these Medigap plans, okay, they can never take it away from you. Doesn't matter how sick you've been, doesn't matter how much you've cost them, you can have that plan for the rest of your life. The only time they can take it away from you is if you stop paying the monthly premiums.
Right.
Okay? And unfortunately, doing this job, I've seen some sad situations, and I've seen where people get sick, they're in the hospital, and they forget to pay their bills. And they end up losing a Medigap because they didn't pay premiums at the worst possible time because they've been sick. And so my word of advice to anyone who does have a Medigap, set it up for auto debit. Don't rely on seeing the invoice and sending a check through US mail. Okay, make it as automatic as you possibly can. Many of the insurance companies allow you to indicate a secondary person to notify if a bill's not paid. Do all those. You don't want to lose these. So once you have that, you're good. Okay. Now again, the premium's going to go up. You may want to switch to a different carrier, and if your health is reasonable for your age, you'll be able to. But worst case, you can keep the one you got forever. On the Advantage side, if you have an Advantage plan, you cannot buy a Medicare. You're not allowed to have one. Okay. So these out-of-pocket costs that I described, $50 for the specialist, $250 for the MRI, they're truly out-of-pocket costs. Okay, you can't have a secondary insurance picking those up. So, so with the Advantage plans, with that kind of approach, kind of the pay-as-you-go, co-pay as you go, if you have a healthy year, just go see a doctor a couple times during the year, you know, it's gonna be a low-cost plan. Okay, if you have that disastrous year, okay, since you don't have a Medigap, maybe you're gonna hit that maximum out of pocket that year. So over here, you're gonna have more variations in your annual cost based on how healthy you are in one year versus the next.
Yep, gotcha.
Okay.
Yeah.
So one other thing on that point, because your point is about pre-existing conditions. So as I said, you can switch from one side to the others during open enrollment, but this is a caveat I want to touch on, particularly related to that point you raised. Let's say you have original Medicare, and you have a Medigap, okay? But, you know, you've heard great things about these Advantage plans, and you want to switch. During open enrollment, you could switch. You would have to give the Medigap plan up. You have to terminate it, you're not allowed to have it over here, okay? And there's never any health underwriting here. You could be the sickest person in the world, but if you want to come over and get an Advantage plan, you can have anyone you want, okay? Let's say you have the Advantage plan for a couple of years and decide, you know, I want to go back. I want to go back to original Medicare and get another Medigap. During open enrollment, you can switch back, but in order to get another Medigap, you're going to have to answer health questions, okay? And if that point in time, your health is not good, has not recently been good, you may not be able to get one. You know, you're ready to switch back, but you know, you had a stroke 6 months ago. You're doing fine now, but you did have a stroke 6 months ago. You're not going to be able to get one. So that's the risk of trying to go that way.
Why would anyone give it up then?
Why would anyone what?
Why would anyone ever give up on Medigap plan then?
I don't know many people who have, but the Advantage plans do get a lot of TV advertising during open enrollment. Okay? You don't see as many ads for a Medigap plan. There are some, but not as many. You see a lot of ads for these, particularly up from October 15th to early December, when people can switch plans. And the ads tend to focus on the extra benefits. You can get dental and vision and hearing. And so those ads tend to attract people. Oh, let's give it a try. Let's try it. But again, someone who's sat over here, has their Medigap, don't see a lot of people switching. Okay? Programs that can save with cost. There are several federal programs and state programs that can help pay for all the costs that we've touched on here. That Part B premium of $202, the 20% copays for Part A and B, the prescription cost. There's programs out there that can help pay for these. The first two that you see, Medicare Savings Program and Extra Health, those are federal programs, okay? The Medicare Savings can help pay for that Part B premium and Part A and B deductibles and copays. Extra Health helps with prescriptions. It can pay for your Part D premium, and it can give you very low copays, $3, $4, $6, $8 for your prescriptions. Both of these look at two things to qualify. One is your income, and the other is your financial resources. Financial resources meaning everything, your checking account, any money you have in the bank, in a retirement account, stocks, bonds, any investment, any monetary type investment. And you have to be below the income threshold and the financial resources threshold in order to qualify for those programs. This last column is a Pennsylvania program called PACE and PACENET, and it helps with prescription drug costs. And it only looks at income. It doesn't look at financial resources. And it has the highest income limit of any of these. There's a slide later on this, but it's geared to help Pennsylvania residents over 65 put a cap on their drug costs. And it's particularly beneficial for brand name drugs. If you're taking brand name drugs, copays can be very expensive. If you qualified for PACE, your brand name copay would never be more than $8 a month for any brand name drug. If you qualify for PACENET, which is a higher income threshold, it wouldn't be more than $15 for a brand name drug. And even that is excellent compared to the cost of many brand name drugs. So if you think that you or someone else you know may qualify for one of these, they should definitely schedule a one-on-one appointment with a counselor, sit down, go through their income resources. If they seem to meet that, we can help them go through the application process. The program I just talked about on the last slide, Extra Help, the federal one that helps with prescription drugs. One of the other benefits of it is that it allows you to change drug plans more frequently. And so you can actually change drug plans if you qualify for Extra Help every month. I think they went overkill and they decided to allow you to do it every month, but that's fine. You can do it every month. I can't think of a situation that it would make sense for someone to change drug plans every month. It could make sense like during the year if maybe you're prescribed a new drug from your doctor and that drug's not covered by the particular Part D plan you're in. All the drug plans don't cover every possible drug. So this would allow you to be able to switch to a plan that did cover your neck. Just a couple other things on prescriptions. Of course, if you are good with generics, you're going to save a lot of money compared to brand name drugs. Some people may not react as well to some generics and have to switch to stay on brand names. That's fine. Sometimes for the really cheap generics, you can get them perhaps cheaper than your drug plan by just being a cash buyer, not using your drug plan, by going to Costco or Walmart or something like that. One thing that a lot of people don't understand is that most drug plans have preferred pharmacies. They have preferred pharmacies, and then they have, some call it standard pharmacies or just in-network pharmacies. You can go to any of those to get your prescriptions filled. But if you don't go to the preferred ones, you're probably paying more than you need to. So it's important to understand who are their preferreds. Does my drug plan have preferred pharmacies? Most do. Who are they? And what would it cost at the different pharmacies? With the tool in Medicare.gov, we can answer all those questions by plugging in your meds. These are some real numbers in this example that came from true situations. You might have a $1 copay for an inexpensive generic if you use a preferred pharmacy, but if you use a standard pharmacy, that could be $10 for the same medication, just by going down the street to one pharmacy versus the other. And on the next tier of generics, it could be maybe $4 at a preferred pharmacy and $33 at a standard pharmacy. And these are real examples. So if you don't know about your Part D plan today, who are the preferred pharmacies in it, and are you going to one, that's a good action item to find out. PACENET, this is the Pennsylvania program I was talking about earlier. This slide includes the income limit for the higher one. PACE has a lower income limit, better benefits. PACE has a higher income limit, a little less benefits. But again, the income there is $33,500 for a single, $41,500 for a couple. And this only looks at income. It does not look at financial assets at all. And this program, there's talk in Harrisburg about raising these limits. It takes legislation to do that. So who knows when or if we will see that, but there is at least discussions about increasing those limits. This is a very good benefit that the state provides, and the money that funds this comes from people buying lottery tickets. So keep trying to get Powerball. Okay. Yeah, keep scratching. Yeah. This I had this slide earlier. I think we did, but again, one of the key things is knowing how to reach out to us. Okay, when you have a Medicare question, no matter what it is. Again, you can get appointments. You can just call a location and make an appointment, or call our helpline and leave a message at any time. This next section is about when you can change your Medicare plans, and this is something that everyone needs to focus on every year. Okay, do not take your drug plan or advantage plan for granted and just say, oh yeah, I liked it, I'm just going to stay with it and not bother looking, don't do that, please. The annual open enrollment period is coming up. It starts October 15th. It's the same time every year, October 15th to December 7th. That's when you can decide if you want to change your plans for the coming January 1st. Everything would be effective January 1st. So by October 15th in Medicare.gov, they have all the information about all the drug plans and all the advantage plans that are going to be in place for 2027. And even if you're happy with your plan will change. Every plan changes every year, okay? Plus some plans disappear, new plans appear. But even if your existing plan stays, here's the type of things that can change. They're going to change the premium, they're going to change the co-pays, change the deductibles, change the drugs they cover, change what pharmacies are in network. For the advantage plans, they can also change for the healthcare side, not just the drugs, their co-pays, what doctors, hospitals are in their network. So you have to look every year, okay? And we have, the PA MEDI program, schedule lots of appointment time at senior centers and libraries throughout the county during that October 15th to December 7th date. There'll be dates here at the library that you can sign up with, meet with a counselor, review your drug plan or advantage plan, whatever you have, see if there's a better one that meets your needs. So please do that every year. That should be an annual event for everybody on Medicare. If you don't do it, you're probably spending more money than you need to, is what it comes down to. If you do have an advantage plan, there's one special open enrollment period that most people don't know about. And it's January through March every year. If you have an advantage plan, there's an opportunity during those 3 months when you could switch out of it, either to a different plan or back to original Medicare and get a drug plan. And this is really what I call the oops period. I've been doing this counseling for about 11 years. I think I've only had 2 people exercise to change plans under this provision during the first 3 months. And in both cases, during open enrollment, they get enrolled in an advantage plan to be effective January 1st. After January 1st came around, they went to schedule an appointment with their doctor. And that's when they found out their doctor was not in network for the advantage plan they had chosen. So they hadn't done their due diligence well enough there. But with this thing, that's like a get out of jail free card. Okay, we get to redo it and get you into a right program. There's some other times, special event driven, when you can change plans other than open enrollment. They don't happen a lot, but it's good to know about it. If you do qualify during a year for any of those assistance programs, federal or state assistance programs that I talked about, they all give you extra times during the year when you can change plans. If you move to another state, then your drug plan or advantage plan that you had here is probably not going to be the same exact one available there. You'd be given a special time to change plans for one that's in your new area. If you lose or drop coverage, non-Medicare coverage as part of your overall health care plan, some people have retirement plans from their employment, and maybe that gets terminated. You'd be given a special enrollment period to change your Medicare plans as well, to try to adjust for that change. And the last thing is, if there are any 5-star rated drug plans or advantage plans, anyone can change to those at any time during the year. Medicare rates all the drug plans. They rate all the advantage plans. Okay? Right now in this area, we have no 5-star plans. So that bullet's not applicable here. But maybe next year will be. Now, a couple other things. This is a relatively new provision. And there were a number of cases where someone, after leaving their work years, didn't get signed up for Medicare on time. And it turned out it was because they got bad information from their employer as they were leaving the job. Unintentional, but bad information nonetheless. So Medicare put a provision in effective January 2023 that if that happens to you, there is now a process to be able to provide information to Social Security, who monitors the enrollments, and document that you were misled by your employer, and you'd be given a special enrollment period and be able to avoid a late enrollment penalty. Doesn't get used a lot, but it's a fair thing to have out there. Medicare rights. Big bold letters. You have a right to appeal a decision. Whether you have original Medicare or an Advantage plan, you can run into situations where a certain thing may be denied. Okay, you can't have that procedure, won't get approved, whatever. There are levels of appeal, up to like 5 different levels of appeal if you care to keep it going. But any decision you get that is a denial, included in that denial letter will be an explanation of how to appeal it. And particularly the first level of appeal is a very easy process. They explain how to do it. We can help you if you need any help. But please, don't just take no for an answer. Okay? You have an appeal process. If you think there's a legitimate reason to appeal it, appeal it. On the Advantage side, Medicare Advantage side, as I mentioned earlier, you do tend to have more denials on that side. But for the people who do get denials, the percentage that do appeal on that first level appeal, there's like 70% success rate in appeal. So don't get discouraged. Use the appeal process that's been set up for you. The other thing you have a right is to complain about poor medical service. Okay, and that does happen. These are places you can file a complaint. One, if it's with your drug plan or Advantage plan, you can file a complaint directly with them. You also can file it to Medicare itself on the Medicare website. There's a link there, or you can call, if you're not comfortable with websites and links and all that, you can call Medicare as well and do that. And within Pennsylvania, we also have something special in Pennsylvania set up, is if it's about Pennsylvania healthcare issues, there's a company that's been designated by the state to monitor the complaints on there. You can also notify them. This is a situation everyone should know about. It occurred a number of years ago. It was actually a lawsuit, and that's why it's called the GMO settlement. It has to do with denials of extended care for skilled nursing or skilled therapy, be it inpatient or outpatient. Prior to this case, Medicare would stop paying for those type services if there was no improvement in the patient. Okay, you've been doing that for 3 months and there's no improvement, so we're not going to pay for them anymore. This settlement changed that. Okay? This settlement clarified that Medicare does need to pay for that as long as it's at least helping to stabilize the patient. May not be improving, but it's preventing getting worse. It's keeping it. So if you know someone who's in that situation, while this settlement occurred a number of years ago, it seems like maybe the word hasn't gotten out as widely as it should have to the various skilled nursing facilities and things. So it's an important thing to be aware of. GLP-1s. Okay, that's a hot topic these days. This is about a special program for Medicare. This is a temporary program, a test program, if you will. They call it a bridge program. It is not a permanent program here. But it is a temporary program to allow certain beneficiaries to get GLP drug, the ones listed here on the third bullet. And the test period is 18 months, from July 1st of this year through the end of next year. It's an 18-month program. Will they extend it? Nobody knows. What will happen after that? Nobody knows. Right now, it's just a trial program, if you will. You do have to have a Part D plan to be able to take advantage of this, and your healthcare provider would need to submit a request to get you enrolled in this program. So it has a $50 a month copay for those drugs, which they're expensive drugs, so that is a pretty good program price-wise. But there are requirements. It can't just be anyone who wants to enroll. As you can see in the eligibility, there's various BMI numbers, and it also has to do with what other diagnoses you have. So they want to make sure that the people in the test pool don't have certain diagnoses that it's going to skew the results. So it's not an automatic. You can't just say, I want it, yeah, let me get that. You got to go through your doctor. You got to meet the qualifications. But if you are eligible, it's cost-wise, it's certainly a good program, at least for the next 18 months. Preventing Medicare fraud, just like identity fraud, there's rampant Medicare fraud. And people are not only trying to get your bank accounts and that kind of personal information, they're trying to get your Medicare account too, and your numbers, and put in false claims and abuse the system. So we all, as Medicare beneficiaries, we all need to take responsibility for helping to identify this and stop it. And one of the ways we can identify it is, look at your monthly or quarterly explanation of benefits that Medicare either sends out to you or they're on your online site, if you have that. That shows all the billings that go through Medicare for you, who it came from, how much it was, and just to look at those briefly and see, did I go to them for that service? Or maybe they got double billed, maybe they billed it twice. And so taking a quick look at those to make sure nothing looks suspicious, that can be the start of identifying some problems. And the more money we can save, that's going to help all of us in the long run. We're paying for this. If you see anything that you think might be Medicare fraud, this would be the number to call. This is a department that's called the Senior Medicare Patrol, and their goal is focus on Medicare fraud. So if you see anything, anything, feel free to call them, give them the information, and they can look into it. Speaking of protecting information, Medicare protects information very well, okay, which is a good thing, but that means they will not give out information about you to anyone else, okay, unless you have authorized them. And none of us know when we're not going to be capable to call Medicare, okay? So really encourage everyone to use a form that Medicare has available called Medicare Authorization to Disclose Personal Health Information. You can fill that out, submit it to Medicare. You can get the form online or you can call them. So basically you give your spouse or a trusted family member that authorization. So if you're in a coma and someone really needs to talk to Medicare on your behalf, someone would be able to do it. Let's see, last slide, I guess. As I mentioned earlier, PA MEDI counselors, such as myself, were volunteers. And the Department of Aging in Chester County uses volunteers in a number of different programs, which are listed up here. Besides the PA MEDI program, a number of other areas that they do use volunteers. So as you're retired and have some time on your hands, if you're looking for volunteer opportunities, keep the Department of Aging in mind, please. And we'll leave that last slide there is, again, how to get in touch with us and if you need us. So take questions now on any of the topics.
Well, the most important question I had was about the gap plan that you already answered.
Okay. Okay. Anything online, Mark?
Nope, just one person needed to drop off, but they said thank you, and the other person just said thank you, so.
Okay, good.
Great
You're
information,
very
they
welcome.
said.
Okay.
All right.
All right, well, have a good evening.
Yeah.
Hopefully the weather's better than when we came in. Okay.
Thanks,
That
Terry.
was my